who still seems to have a sense of humor there in that video, says that the state has seen a 63% increase in COVID-19 hospitalizations over the past 2 weeks. Taking a look now at our local hospitalization numbers. We start in Monterey County, which is showing 48 people are hospitalized tonight with COVID-19. That's an increase from 4 compared to last week. Santa Cruz County is at 20 hospitalized. That's 8 more than last week. And San Benito County is showing 2 more people hospitalized. That's 1 more person compared to last week. And our KION's Drew Andre live for us tonight in Santa Cruz to explain how our hospitals, how they're facing new challenges still ahead this season. Drew?
So Veronica, about a week after Halloween, health officials started to notice that upward trend in cases here locally. Right now, hospitals are starting to feel that surge and fear it could get even worse if people don't follow health guidelines and gather indoors.
COVID units on the Central Coast are facing their most daunting task yet as hospitalizations are sharply rising.
The most pressure that we've seen to date with respect to this pandemic.
Even more so than any little spikes we saw over the summer?
There's every indication that this will probably be at least double the summer surge.
Take Salinas Valley Memorial Hospital. Last week, its COVID unit had as many as 31 patients. Salinas' summer surge was largely ag workers. Now it's a wide range of areas and demographics. The most concerning trend, patients over 65.
And that's alarming, right? Because the older they are, the more medical problems they have, the higher the chance that they're going to require hospitalization.
Spencer has also noticed COVID-positive patients are waiting too long to check into the hospital.
So if they do get diagnosed with COVID and they find that they're finding it more difficult to breathe, or they're just not improving and things are getting worse, that's the time when they should come in, before it's too late.
SVMH says they're well equipped for a steeper surge, and hospitals around the county coordinate on a weekly basis. In Santa Cruz, an alternative care site at Roadway Inn in Watsonville can be ready to roll in just days if it becomes necessary. But as hospitals face pressure, it also means less room for other emergencies like surgeries and heart attacks.
We're going to overwhelm our limited healthcare capacity. And the hospitals are not going to be available for all the things that we expect them to be available for. This can be stopped, though, and I want to make sure that everybody understands this, that it doesn't take any magic. It takes following the precautions we've been talking about for months.
Now, space in intensive care units has drastically improved since spring, but Ghilarducci says one of the biggest problems is making sure they have enough staff to be there and staff that's healthy. Veronica?